సో ఈరోజు మేము థైరాయిడ్ ప్రాబ్లమ్స్ గురించి మాట్లాడుతున్నాను. సో బేసిక్లీ థైరాయిడ్ ప్రాబ్లమ్స్ టూ టైప్స్. వన్ ఈజ్ హైపోథైరాయిడ్. హైపోథైరాయిడ్ అంటే బాడీలో లో థైరాయిడ్ లెవెల్స్. సెకండ్ ప్రాబ్లమ్ hyperthyroid. Hyperthyroid basically means that the thyroid hormones are more in the body. So what is thyroid and what are thyroid hormones? I'll start with something basic. So we have a thyroid gland in our neck here. It produces two hormones which are T3 and T4. They are thyroid hormones. They are required for most of the things that we do in our body, and they are regulated by another hormone called TSH. TSH comes from brain. There is one more organ in the brain called pituitary. It comes from the pituitary organ, and it regulates the thyroid gland. So most of the times when you check your thyroid levels, you will be checking TSH, which is thyroid stimulating hormone, and by checking this, we basically come to know the status of thyroid hormones in the body. So what causes thyroid problems, and why does this happen? So the most common thing is that it is hereditary. There can be some problem in genetics. So we see quite often that we inherit. If your parents have thyroid problem, there is a likelihood that you can also develop. Not 100%, but there is some chance that you can also develop. Other than that, there are a lot of chemicals in our surroundings that can disturb our hormones in the body. So these include simple things like plastic bottles in which we drink water, or insecticides and pesticides. Nowadays, whatever fruits or vegetables we eat, how much ever we wash them, we can't really remove all the insecticides that have been used. So they also basically interfere with our hormones inside the body. Other than this, many other things like reheating food in plastic inside the oven can also lead. In fact, even shampoos, soaps and sanitizers can also have chemicals that disturb your hormonal balance. So basically, because of increase in the use of these things, the thyroid disorders are more than what we had 2 generations back. Our grandparents did not have as much thyroid problems as we have now. Another reason is that we are detecting it more. Nowadays, a lot of health packages include thyroid test as well. So earlier, even if someone had thyroid problem, they wouldn't know till it was very late. But now we are detecting even mild thyroid problems. So that is one more reason why we see thyroid problems so commonly. Then there can be a disease due to low iodine level in the body. So if the iodine that we are eating is not enough, again it can lead to thyroid problems. It is unusual. It is the low iodine problem is more common in the sub-Himalayan belt. It is usually unlikely to happen in this part of the country, especially when most of us eat iodized salt, that is white salt which is packaged. That takes care of our iodine requirement. So that becomes a unlikely cause nowadays. The most common cause is what we call as Hashimoto's disease. So it is basically because of the genetic factors and the other problems that I just discussed. Other than that, there can be some medications, especially cancer medications, that can interfere with your thyroid gland. And various other causes, like if there is some injury or radiation damage to thyroid gland, that can also lead to low thyroid hormones. Again, this was mainly about low thyroid hormones. If our body has more thyroid hormones, that is hyperthyroidism, it can again be temporary or permanent. So if you are diagnosed with more thyroid hormones, it is not necessary that you will require treatment lifelong. So first we need to find out whether your thyroid problem is temporary or permanent, and if it is temporary, it usually resolves on its own and we just have to give treatment for 2 or 3 months. If it is permanent, again we try to find out what is causing more thyroid hormones, and based on that we suggest treatment. And nowadays there are permanent solutions even for the thyroid problem that is permanent. So you might not need to take the tablet for high thyroid hormones lifelong. It depends. We see on the clinical features of the patients, and we do some tests based on which we can find out whether you require a lifelong treatment or it might get cured on its own.